There you go.
28-year-old Erica Creech has gotten used to lifting her daughter with one arm.
You gotta get that because I can't reach it.
In 2004, Erica learned she had no cartilage in her left shoulder joint, just bone against bone.
And it started, grinding and clicking and not working, and I had a lot of pain with it.
Her problems began several months after an operation to fix a dislocated shoulder.
The pain just started escalating months after the first surgery.
31-year-old George Lumanzakis had the same surgery with the same results.
The pain is constant, 24 hours.
George and Erica's surgeon x-rayed their shoulders and told them they were among a dozen of his patients who had lost their cartilage.
Right in here, the space is gone.
Compare that to what a normal shoulder looks like with space between the bones. In some cases, the bone itself had deteriorated.
The bone has collapsed and is starting to flatten.
After reviewing the cases, Dr. Charles Beck realized they all had one thing in common.
The use of a postoperative pain pump catheter.
These pain pumps feed medicine into the body to reduce pain after surgery. New models had just come out that gave patients a lot more medicine. Dr. Beck had used them in 16 patients. 13 lost their cartilage.
Thought in good faith we were doing something to help our patients' pain, and we actually created a far worse problem.
After realizing the connection, a colleague of Dr. Beck's emailed one of the pain pump companies about the problems, and Dr. Beck published medical research to warn other doctors. Soon patients were coming forward all over the country.
There have to be thousands of people that have wound up with this shoulder destruction.
At least 500 cases are now being filed as part of a class action lawsuit against the pump makers, which still have their products on the market.
To our knowledge, these pain pump companies are not notifying physicians to specifically not use this pump in the shoulder joint.
Doctors say the companies also didn't tell them the FDA had not approved the pumps for use in the joints.
The FDA has approved these pumps for use outside the joint. We have not uncovered any pre-market testing in the joint.
That's no reassurance to George and Erica, who have to live with the consequences of an irreversible condition.